about somebody who has good visual acuity only in one eye? The other eye is optically normal. They can get a nice, good retinal image in that eye, but their brain doesn't use the information from that eye, right? That's called amblyopia. And assuming that the person can have at least, what often happens during infancy, well, not all, but sometimes happens during infancy, if the eyes are not properly aligned and you get cross-eyed or exotropic, one eye will take over, become dominant, and the brain will stop listening to the other eye. That eye that is not being listened to by the brain has perfectly good optics. The information coming out of the optic nerve is just fine. It's just being shut down, and the brain hasn't learned to use it. So the question is, first of all, how do you restore that? In children, the usual treatment is you cover the good eye and make them use the bad eye and wait for the brain to learn to use it. And then there's a wonderful book that you should get if you're interested in this question about restoring binocular vision and depth perception, which is a book by Susan Berry, B-A-R-R-Y, called, what's Susan's book called? Fixing My Gaze. Thank you, Kelly. Fixing My Gaze. And it talks about, she's a person who did not have stereoscopic depth perception, and she talks about the process by which she regained it. It took a lot of work, but she was able to train her brain to see depth from stereo. So that's a book I would recommend. Oh yes, you can see depth if you only have one eye, because there's so many different ways to see depth besides using binocular disparities. Yes, there are lots of ways, like these occlusion cues, right? You can tell my hand is in front of my face because it's blocking the view of my face. That's called occlusion. There are many, many depth cues. People who don't have stereo vision often don't even know it because there's so many other depth cues that they can use. Yeah? Depressive people are better at seeing gentle gradients of light, from light to dark across the whole visual field. And normal people or people who are not depressive will just see it as uniform field, even though I don't really know much about that. I've heard that it's somewhat plausible because to see a gradient like that means that you're not doing the normal thing of calibrating the two parts of the image and equilibrating them. So maybe it's a failure to equalize parts of the image and normalize the images could be a generic consequence of an imbalance in neurotransmitters, but I just don't know anything else about that. Sorry. Blue shirt in the back in the middle there?
Yeah, so if I'm walking on a subway platform, there is a subway pretty close to my side, and all of a sudden it leaves, there's that void of space. I often have a lunging, subconscious lunging effect towards the space. And I wondered, I guess, do I have some like weird death wish? I'm hoping that you can tell me there's like a spatial visual thing.
So the subway is, you're on the platform, a subway is leaving, and as soon as it's gone, you feel like you want to fall into it. Yeah, you want to fall into the track as soon as the subway is gone. Yeah, well, why does that happen? Trains are really big, and they occupy a lot of your visual field. And in fact, that's why this illusion that one sometimes gets of what's called vection will occur when you're sitting in a train and looking out the window and the other train is moving, but you feel like you're the one moving, right? Because those same motion signals are used to make an inference about how you are moving as whether something in the world is moving. And if you attribute the motion wrong, even just partially, and perception does this all the time, it gives some weight to one interpretation and other weight to the other interpretation, rather than, the real world has to be either one or the other most of the time. But perception often will give these weights like that. If you're giving any weight at all to a self-motion signal, you could imagine that stopping the train, or the train is moving, you adapt to it, and then it disappears. That's a big change in the visual input that could cause you to have a change in apparent self-motion. So let's get somebody on one of the sides, and I can tell we have way more people than we're going to have time to answer questions for, but we'll try and do them quickly. Okay, here's the question. There's a famous experiment that our question asker asks about, which is cats reared in a special environment where there are only horizontal lines or only vertical lines. Well, that is correct. They do develop abnormally. They have neurons. If you raise a cat in an environment that has only horizontal visual lines in it, they are unable to see vertical lines. They will bump into them behaviorally. They'll just run right into them. And they don't have neurons in their brains that respond to vertical lines. So part of the way the visual system develops is by assuming that there's going to be a certain distribution of inputs. Now, that's true for cats. It's definitely true for people. If a person has astigmatism, which is blurriness in one direction only, they will not develop good visual acuity in that direction. Right? So things will be blurry along that way, but clear along this direction, and they'll develop a little meridional amblyopia. So you do see the same thing in people. And the second part of the question was, is there a critical period? The cats, if you raise them normally and then put them after, say, 6 months into this funny environment, they've got the neurons, they don't lose them. They can see vertical from then on. There is a critical period, and there's a big debate right now about how important the critical period is in infancy and whether it might be possible to reestablish plasticity in an infant, or rather in a child or an adult, with drugs or something. But they might make you forget everything you know, because you're going to be able to rewire your neurons the way an infant can. So it's kind of tricky.